I thought that I would give an update. It has been exactly 1 week since my breast biopsy was done, and I thought that I would just share what my experience has been like in the week afterwards, the recovery and how I feel, and what it's been like. So I, for the majority of the week, would say that I really didn't feel like anything had happened to me. I didn't even feel like I underwent any sort of procedure. It was really surprising to me. Beforehand, I was very anxious, really afraid of how I was going to handle it, mainly because of my other health conditions, and sometimes things can cause them to flare up, or I become more symptomatic if I go through stress or, different things like that. So I thought that maybe it was going to make me go into a flare up, or it was going to make me feel a lot of pain. I noticed that over the last few years especially, I have become increasingly sensitive to things that I previously wasn't sensitive to. And I think it might be a result of my other chronic conditions that are, I guess getting worse as I get older, or I've just been in a really rough patch of years, and, my body needs some healing, and, I've been on that journey for a while, but I have noticed more recently that some of the issues that I have noticed that have been increasing as time goes along, as I get older, is my nerves seem to be more sensitive. So I had gone to the dentist back in October to have some fillings done, and I afterwards never really recovered. So it has been quite some time since October, and still in those areas where the fillings were done, my gums will have flare-ups where they get very inflamed and really painful, and they hurt. I would rate the pain like an 8 out of 10 when they flare up. It's pretty bad. I have gone back into the dentist numerous times just to have them check out that area, make sure there isn't an infection or anything like that. I've had, multiple x-rays, and I've just been told there's no infection, and that it is something systemic within my body that's causing me to have this kind of a reaction. I've been told through my specialists, through my doctors, that it's likely mast cell related, and that is what is causing my problems. I'm not really sure exactly what it is, but I know that previously when I went through like dental procedures and things of that nature, I did not have those kinds of reactions when I was younger. So it made me wonder, what was going on. My nerves, even in my skin, like on the bottom of my feet, on the bottom of my toes, they feel like they're very sensitive. Like when I walk on the carpet, sometimes it feels like it's burning. My back just has a lot of nerve sensitivity in it as well. So I was scared that when I went to go and have the biopsy done, because I have become so increasingly sensitive, that was going to be really hard for me to make it through and to recover from. So the doctors that I had were very, it was one doctor actually and some nurses, but I had some questions beforehand. I was able to talk to the doctor a little bit because I was having second thoughts about it. I was given a paper to sign that indicated that there were risks involved, such as blood clots, stroke, heart attack. It could be fatal. I did not know that beforehand. I was not, up until the moments before I was about to have the procedure, that wasn't explained to me. So my anxiety started to kick in. My doctor that was doing the biopsy had come to talk to me and was just a very matter-of-fact kind of person, and not a very warm, kind of compassionate nature, I guess. Not that they weren't caring, it's just that they were just more, I guess, like logical, analytical kind of, thought process, I guess. And ultimately, I had just asked if maybe what I had could just be monitored instead of being biopsied. And I was told no, that they needed to be biopsied because they were not just a benign cyst. So at that point, I was more nervous, I think, to not know the answers than I was to get the procedure done. So I decided to just go ahead and do it. I was told that you could take an anxiety medication if you felt like it was necessary before the procedure happened. And I knew that I was not going to be able to do this without anxiety meds, so my doctor had prescribed me anxiety medication, and I brought that along with me, and the nurse had checked it all out, and instead of taking the full recommended dose, I actually broke it in half and just took half of it. I do not like anxiety medications because, like I said in a previous video, I experienced really bad side effects in my early 20s being on anti-anxiety and antidepressant medications. I was suicidal, so I avoid anxiety medications entirely. But for this particular procedure, I knew I was going to need something, and so I took it. I think that it was good that I took it because it did help me to be more calm in the moment as the procedure was being done. However, afterwards, I regretted it because the degree of fatigue that I feel on a daily basis as it is horrendous. Some days, many days, it is disabling. It is debilitating to the point where, it's not just like feeling tired. It is like really hard to function, if you can function at all, through the fatigue. So taking the anxiety medicine made me feel a level of fatigue that was just even worse. So when I came home from having the procedure done, I think that the doctor or the surgeon that did it was very good. They did a really good job. They were very careful, and I think that helped in my healing process, and that maybe is why it went a little bit easier for me afterwards. But I would say immediately after the procedure was done, I would have rated the pain a 1 out of 10. It was noticeable, like as I was putting my bra on, as I was moving in certain ways. It was slightly noticeable that something had happened in that area, and I expected once that the numbing wore off. They used, I think, lidocaine to numb the areas. I expected to feel like a lot of pain, and I was pretty shocked because I did not feel anything above a 1 out of 10. I was told that I could take Tylenol beforehand to, like, as an extra pain management or reliever. I really don't take Tylenol often either, so I really, even if I'm really sick, a lot of the time I just don't take it, and I've always been that way since I've been really little for some reason. But I thought that I would just take it because I really thought that it was going to be bad for me, so and that the pain was going to be unbearable. So I took the Tylenol beforehand, and I can say that I don't think that I even needed to take it. I had anticipated that I was going to probably need to take another dose as soon as my first dose of Tylenol wore off, and that for the subsequent days I was going to need Tylenol to manage pain. But after taking that first dose before I went in, I didn't need to take any other doses of Tylenol. So it was only the one beforehand that I ended up taking. And I wore a very supportive bra, which I think helped a lot in my overall healing, in my process with it. So I kept it on as long as I could throughout the week, and just really made sure that that whole area was kept really like in the compression state from my sports bra. I was told to use ice packs on the area pretty much right away to reduce bruising and swelling, and to keep it on for like 30 minutes and then take it off for like a couple of hours and just keep doing that. I did try to use an ice pack at first, I would say maybe a couple hours after I got home, and the washcloth around my ice pack wasn't getting cold, so I just gave up on it. I did not continue to ice that area, and throughout the whole process I didn't ice it after that, and I still did not experience pain beyond I would say the first few hours afterwards it was like at a 1, and then the pain went down to like a 0.5, I would say. And after the third day, about that 0.5 just completely went away, and it was like nothing even happened. So for the remainder of the week, I forgot that I even went in, that I even had the procedure done, and I didn't notice anything out of the ordinary. I did, however, I would say the second or the third day afterwards, develop a huge bruise. I am somebody that bruises really easily, as it is, so I did think I was probably going to get a really bad bruise, but I've never had a bruise to that extent or to that size. It was really, really big. But despite the fact that it looked really bad, it did not hurt like my other bruises typically are, like sore to the touch and everything like that. For some reason, I did not have that feeling there. And so then I would say, so yesterday it was exactly 1 week, so I'm at about 1 week and 1 day right now since the procedure was done, and I was told that you are not supposed to lift anything over 10 pounds, and you're supposed to not, push and pull things for 7 days afterwards, just to, I think, reduce the risk of like further bruising and swelling and discomfort and all of that. And I forgot yesterday that I even had anything done last week. And by that point, I would say at about day 5, I switched from wearing the really supportive sports bra back to my regular bra, which doesn't provide quite as much support as the sports bra that I was wearing. So I went to go and try to vacuum yesterday. I am left-handed, and my biopsy was done on my left side, and when I went to go and vacuum, I think I was using my left hand to vacuum, and all of a sudden I started to feel something didn't feel very, very right or very comfortable, and I entirely forgot that I had the biopsy done until that moment, and remembered and realized why I was feeling the discomfort that I was feeling, and the first thing that I did was put my sports bra back on, and then I tried to switch arms to vacuum with my right arm instead, and then I just took it really easy. I didn't do like all of the things that I wanted to do or needed to do in terms of like cleaning, and I just shut the vacuum off, and that was it. So I don't think that at 7 days out, at least for me, I notice, I'm not fully healed. I'm not fully healed to the point where I can do my normal or usual activities without experiencing discomfort there. But even with the discomfort, I, caught it soon enough, and I didn't push myself. I really listened to my body, and I stopped what I was doing, because if I would have kept going, I think it would have been, pretty bad. But even in that moment, I would say it was like a 1 or 2 out of 10. But I don't know how long it's going to be like that for. I was told for 2 weeks you are not allowed to do things like go swimming or, have like a bath or anything that has water constantly in this area. You can take a shower, but I was told that you are supposed to just like let the water run over that area, not really, have it in there constantly. And I was nervous about the adhesives that they used. They used a medical grade glue for me. It was itchy the first few days, especially. The worst part about this whole process for me, I would say, was the fatigue afterwards and the itching of that area. So I did not have the kind of reaction that I sometimes will have to other adhesives. So the little medical grade glue spots that they put on those areas, they are still there. So it's 1 week and 1 day later, they're still there. I was told that they will just peel away naturally with my skin as it heals. So I'm not, trying to take it off or anything. The overall, I would say that the worst part about it all is the restrictions, just feeling like, you have to have a little bit more caution, I guess, when doing things, and the fatigue. But as long as you do be mindful of, taking good care of yourself and listening to your body, I think that overall the whole process for me really was nowhere near what I imagined or envisioned it being. It looked and sounded a lot scarier than it ended up feeling. So I just thought that I would share, my personal experience with it all and where I'm at now 1 week later. And maybe at some point, if somebody comes across this can be helpful information to somebody. I have a great respect for women who have to go through actual breast cancer and like chemotherapy and, all of these procedures, so much more, because just the biopsy itself, the stress and the anxiety from it was so bad. Aside from the fatigue, I would say that the stress and the anxiety was by far the worst part of the whole process. But I am just glad that it is done and that it is over, and I thought that I would just, give an update and share where I'm at now 1 week out from the procedure, and what it was like. So that is it for this one.